Hello everyone, I am Serena, known as Cease or Rena. I'm a mother of 3 children, moved here from Grand Bahama about over 30 years ago, travel back and forth as often as possible. I'm a retired nurse, diagnosed with lupus in 1996 after giving birth to my last son. At this moment, I do some volunteering, but was forced into retirement 5 years ago, I think. Yeah, about 5 years ago. So I wanted to share with you guys a little bit about what I've been going through since being diagnosed with the disease itself. The first thing with lupus, 1996, when I was diagnosed, it wasn't as popular as it is now. So when they told me that I had lupus, I went into denial because it was so graphic the way that they explained it to me. The explanation was, you have this disease and your life expectancy is 20 years. So that kind of just shut me down. I did not take the medications. I just continued on with my life as if nothing was wrong with me. A few years after the diagnosis, I started developing joint pains. And being in the medical field, I was surrounded by doctors. A lot of them were saying that, oh, you have rheumatic fever, you have this and that, different autoimmune diseases, but not lupus. And they were treating me for this, giving me like B12 injections and different things. And I just continued on because mentally it was like, they're giving me this and I feel great. But after a few weeks or maybe a month, the pains will come back. At that time, I was working in a clinic, and I transferred from the clinic to a hospital where I met Dr. Brown. And he was the one that basically said to me, this disease can be treated, can be controlled, but you definitely have lupus. And with lupus, there is several different antibodies. So if they're testing you for this disease, ANA must be positive, plus several others. With me, I believe there's 8 to 10. Out of the 10, all 8 were positive. I had the ANA, SSA, SSB, and so on, so on, so on. They were all positive for me. And they immediately put me on steroids. I was on steroids for 4 years or so, and that's when the disease really began to attack my body. The first thing that happened to me that I realized, besides the joint pain and the aches, is I had a stroke. I was at home and I lost the ability to speak. And thank God my sister was there, my children were there as well, but we decided to go to the emergency. And they did their test where they test your strength and everything, and realized that I had something called a TIA. It was a ischemic attack. And it causes you to lose speech, to lose sensation on either side of the body, and it can reverse itself just as quick as it attacked you. It can reverse itself back and you're normal again. So that's what happened. By the time I went to the emergency and got there, I was already beginning to feel a little bit better, and by the time I left, I was able to walk. Of course, it wasn't 100% back, but then, I have lupus discoid, which affects the skin. And if you don't take care of it, it can turn into something that's really bad. So I've seen people that did develop MRSA. I mean, just get very sick because the disease is so bad. You have no immune defense already. So if you allow any little thing to take over, it's going to get out of control. And that's what happened. You know, in my case, hard-headedness was my problem. Like, I felt like, you know, I can handle this, I can do this, I can do it. And I would press it and push it as far back as I can. And then when I get in the hospital, it's so out of hand that it takes longer. You know, if you have an issue where you're overweight and you let the weight get to 400 or 500, you're not going to lose the weight in 2 months or 5 months. You know, it takes years. So the same time that it took for my body to develop whatever it was going, it takes longer to resolve the issue. And I learned that going through the process of encountering all these different things, the TIA, I had more than one. Losing the ability to walk, I lost the ability to walk on 3 different occasions. So after the last time that I've lost that, I promised myself that if anything happens, I don't care how minute it is, I'm going to seek some kind of medical attention. I'm not telling you that I'm going to agree with what they say, but 2 minds are better than 1. And having the knowledge that I have, I know that if I'm hearing something from someone and whatever they pour into me, I can go home and research it. So I would advise anybody that has lupus, do your research. Get on the computer, I don't care how much you think you don't know, and try to learn from whatever you can to educate yourself on what you can do for yourself, because it affects all of the lupus differently. We all have different symptoms. We all go through, you might have some that's the same, but the majority of us have different issues. I might be suffering with bone and muscle, and somebody else has kidneys and heart, you know, or hair and whatever. Because if you go through lupus, people always say, why do you have to have chemotherapy? If it gets to the point where they feel like all the other medications are not working, they try to treat it, they call aggressively. And there's some chemotherapeutic drugs out there that will quiet the disease down. That's not saying it's getting rid of it. They still have no known cause for it. They don't know where it comes from, and they don't really know how to treat it. So if you go in and you have lupus and you have a heart disease, they'll give you heart medication. Like I told you, I lost 2 fingers. And I knew prior to that I was diagnosed with something called Raynaud's. And Raynaud's is something where the blood vessels don't dilate, allowing blood to flow to your extremities. Now, I've had several cardiac workups. My heart is fine. If you go in, they'll say, your heart is fine, everything is good. But with the disease, the blood vessels are still not dilating, allowing blood to flow to where it needs to flow, causing Raynaud's to my fingers and now also my toes. They give me something called nifedipine. Before the nifedipine, I was on Viagra, sildenafil. It's there. It's a dilator. If you put the 2 and 2 together, you know what it does to a man. So I dilate. Okay, so I was on that, but it was so strong that I had to discontinue it myself. Just get myself off of it because I was getting to like fainting spells. Yeah, it's very strong. So whatever it is that the symptoms are like happening, they give you the medications for it. And then I don't feel like it's necessary, because if you have lupus, the disease is what's causing the problem. So let's fix the problem, and then we don't need to take these medications. You know what I'm saying? I just discontinued it, and I still take the nifedipine, but periodically. And I started doing research to see what I can take to replace it. The herbs are the burdock root, sarsaparilla, and the sea moss. So I've been doing that to see, if it helps. Now it's going to take some time. I do feel that the difference is I don't have to take it as much. I don't feel the side effects of the Raynaud's as much either. Before, like how the house is cold, I have to be wrapped up from head to toe, because the cold affects it. It affects my joints and all those things. So my thing is learning your body, learning what the disease is doing to your body. Go online, look it up, find, they're gonna give you the traditional way they treat it, but then you also look for a natural way. It has to be something out there natural that you can take, at least try it while you're still on the traditional way and see how it affects your body. And if you see that it's working, cut down on that poison that they're pumping into your body, and just cut it out. 2003, like I told you, was the first time they diagnosed me with something called transverse myelitis myositis, inflammation of the muscles. And my thing is, being in the unit with pediatric babies, they required us as nurses to get vaccinated. That was the first mistake that I made. I took the vaccination and I was going on vacation. And I went on vacation. And when I came back, I lost all ability to walk. And come to find out, like I said, with the disease, your antibodies fight against antibodies. And what is a vaccination? It's an antibody. So that was a big mistake that I made. I don't take flu vaccinations. I don't take the pneumonia vaccine. I'm against it. I just do the best thing I can do, stay away from people, wash my hands, take my vitamin, pump my supplements in me to keep myself as healthy as possible. But when you have this disease, you got to be very careful of what you're taking, what you're allowing them to give you, because your body is as susceptible as a child, a young baby. If you're an adult or you're not an adult, you got to be very careful of what you're doing and who you're allowing to, be around you and stuff like that. So with that being said, I don't take vaccinations. If they told me to take it, I'm smart enough to say no. I'm not going to do it. You have to know what medications work for you and what don't, and don't allow them to just give you anything and you take it because they're saying take it, and then you notice I was doing fine over here and now I'm having this or I'm having that, and it's the medications that's causing you to have these things. I was so happy that, I always try to educate my family about certain things. In 2011, when this incident happened where my son found me on the floor, that my children were smart enough to not let the doctors and nurses tell them what they should do, and allowing them to put me under the ground, because pretty much they were saying that I'm not living, my life is over, call the family and let's just get rid of her. But I was going through some things at home, having headaches, feeling fatigued, not feeling well, and I thought I had the flu. My sister was there, and I asked her to go and get me some flu medicine, which she did. She left after a few hours being with me, and within 2 or 3 hours, my son found me on the floor with seizing and unconscious. So when the ambulance came, they tried to do their assessment and found that my sugar was very low. I had bottomed out below 30, and that's not normal. I'm not a diabetic. And they were trying to give me dextrose, which is sugar, and they weren't able to get a vein or anything, and got me to the hospital, and I started coding at the hospital. So I'm seizing and coding at the same time. They were able to kind of get me stabilized. putting me on Propanol, which was something that they gave Michael Jackson. Yeah. And they got me stable, and now I went into a coma. So while I'm into this coma, they're saying, it's not looking good. They're running tests. They can't find the source of the problem. They had no diagnosis, none. The whole 30 days or whatever days I was in the hospital, they never diagnosed me with anything. But they were pumping all these different things in me and telling Rashika, oh, your mom has this, or your mom has that. Then come back and say, no, she don't have this, or no, she don't have that. They never could find the problem, but they're giving me all these medications. Now, they're not familiar with the drugs that they were giving me. I learned this after I woke up and find out that, why were they giving me Propanol? And besides giving me Propanol, they got me on Oxy and all these different type of medications at the same time. That's why I'm not responding or waking up, because you're pretty much killing me. I'm probably like 90 pounds at this point, and you're pumping all this medicine into a small frame person, and my body can't take it. Eventually, the nurse, thank God, was there. She told Rashika, don't let them pull the plug on your mother. She pointed at the bag and told her, look at the bag. She's urinating. That's not the machine. She's actually urinating on herself, for herself. If she's urinating, that means that her kidneys are functioning. If her kidneys are functioning, her heart is functioning. That means she's living. Don't listen to them, and that's what she did. She didn't sign the paper. They told her, sign the paper, call the priest, bring all the family. Let's pull the plug. That was, I don't even know if it was the 5th day I was on this thing, because I wound up being, I think, intubated and unconscious for 10 days. And the 10th day, probably before that, they noticed that I was responding. And they had to, because then they're not just going to pull the plug on that day. And the 10th day, they pulled the plug, and a few days later, I went home. Saw the nurse who was treating me, and I guess she saw me, because I have my wig on. They saw me without the wig. So by the time she saw me, now I'm on my feet, pretty, I can't go out looking bad. I have my wig on, had on my nice clothes, and she saw Rashika. So she stopped there and she said, how's your mom? She said, how's your mom? Rashika said, my mom's right here. And the lady looked like she saw a ghost. She screamed and she, put her head back, and she was like, no, this. And I just smiled. I said, yes, it's me. And I told her, I say, it's the kind of God that I serve. I say, you have to believe and trust in God. And thank God my family believe in God. Because had not, I won't be walking out this hospital today. And I couldn't find the nurse who really had faith and believed, and encouraged Rashika not to. So if I can't stress anything else, I would stress the importance of family, the importance of having someone around you that knows something and that's not going to allow the medical team or nurses to encourage you to do something that you should not do, And after that, I still was kind of iffy about running to the hospital, but it changed me. It changed me in the way I look at your care team and even myself as far as going to seek medical attention. So at 2003, 2011, and then I moved here in 2014, the end of 2014. In 2015, I encountered a very bad flare. I developed this little bump on the back of my right leg, and I didn't think it was anything. And I just kept going on with my normal self, but I did have doctors here that didn't know much about me, my history, They just knew that I had lupus. And the first doctor that I had, I don't feel like he was knowledgeable about the diagnosis, the disease. He knew of lupus. He was a rheumatologist. But the first time I met him, I just felt like he didn't know anything. And I would go in and tell him, this and this is going on. He just, take your Plaquenil, take your prednisone, and I was on some other medications, and you should be fine. And I listened to him until it got to a point where I couldn't deal with it anymore. By the time I decided to go to the hospital, I couldn't urine. I had a fever of 105. They decided to admit me. I went to, not Carolina, this is like one of the biggest hospitals there. I went to Mercy. They had no idea what they were doing. I'm in the hospital, sick as all outdoors. They're saying that they're treating me, but I'm getting worse. They say I'm better. I couldn't walk, so they released me to a nursing home. All the while, this thing in the back of my leg is getting worse. In this nursing home, the doctor is supposed to come in and visit patients daily. Well, she is working and I'm pretty much alone. And at this point, I'm frail, like very weak. Barely, I can't even get up to walk because I'm very sick. They have to come in and bring the bedpan and all these things so that I can go to the restroom, or somebody got to come and carry me. Anyway, he never came. The bump turned into a hole. And by this time, she knows about it. She made a complaint. Then, I think it was this finger. That was the first one that was bothering me. It was bothering me, and I kept saying, the Raynaud's is acting up. The Raynaud's is acting up. They called my doctor, and she told him to use warm water to bring circulation back. I can't do it myself because I'm alone. Nobody's there with me unless she comes and, So I'm telling them I'm trying to do it as best as I can, and it's not working. And this went on for about a month, maybe. By the time that month was over, Rashika realized that they weren't doing anything. She AMA'd me. So we discharged ourselves. We left against medical advice. And we went to Carolina. And when I got to Carolina, that's when the ball started rolling. I couldn't urine. By the time I got there, I couldn't urine. I couldn't walk. I had lost about 10 more pounds. And they start running tests. That little bump turned into something so big. I mean, it had to be about 5 to 10 centimeters in the back of my leg. I got into Carolina. They got me into the room, and I was really sick. I was still not able to walk. And they brought in the surgeon, and she realized that it was deeper than what it actually looked superficially on the top. And because of the infection, now I got MRSA, no contact. You couldn't come into my room without gown, mask, gloves. Rashika's at work. I saw the surgeon that morning before. They did a CT, and this time I'm in so much pain. I mean, I can't explain to you the pain that I was in. For them to do the CT, they had to highly sedate me because of the pain that was back there. Once they finished with that, they took me back upstairs, not even an hour. The surgeon called and said, she needs to go into the operating room now. I had no time to notify nobody. And they took me down to the OR, and literally debride all of the meat and fungus out of the back of this leg. You saw how much dent is in the leg. They had to take it all out, clean out all the pus and whatever that was back there, and it made it even more larger. Yeah. So they wanted to skin graft, and because of my autoimmune disorder, the healing process took over a year. I wound up with, in the hospital, they had me on a wound vac. It's a machine that they put on you, and it's like pumps to kind of keep circulation going and try to heal the wound fast. And it still took a long time for it to happen. So the skin graft never happened. Now I'm in there. My finger, this finger, was already necrotic, and then this finger began to turn black. So I'm complaining about that, and they're not focusing on that. And I'm going to tell you, if you ever have Raynaud's, pay attention, because for any part of your body to die, it's not an easy process. It's painful. So while I'm going through that process, I'm in a lot of pain, and my family don't understand. And my sister decides to come in the day that they were changing the wound back on my back here, and she started to cry. And she said, how can you deal with this? And I just, said to her, what can I do? It's either fight or die. And I don't want to die. So I have to deal with it. And I'm pretty much trying to put on a brave face, but anytime they would come in to change it, I would have to tell them that I need pain medication. And they would give me the pain medication, and it would still not work. Because it's like the thing was so close. It's no nerves back there, but it was just painful. I would tell anybody, if you got a scratch, go and see somebody right away. Don't wait. Don't, I can treat it at home by myself. No. It took less than a week, and it was infected. And had I probably gone to the doctor, and even when you go to the doctor sometimes, and you say something, they don't believe you. On several occasions, I've had pneumonia. And I will go in and say, I'm coughing, and it's productive. And they want to just tell you, take some cough or cold medicine. You have to be persistent and insist, look, I've dealt with this before. I need you to do an x-ray. It's not coming out of your pocket. Just do it. I've done it on several occasions, and I had pneumonia. I've known people myself, young, that died from walking pneumonia. Just because you're walking around, you cough and you think it's okay, and you're not trying to find out what's going on, you walking around with pneumonia, next thing you know, you dead. I had just encountered that recently, and now they're telling me that 10 to 15% of my lungs is scarred. And tell me, why is it scarred? When I'm going to see you as a primary care, because the rheumatologist wants you to have a primary care. If you have a heart issue, you need a cardiologist. If you have lung issue, you need a pulmonologist. And if you go and see the primary care, she doesn't want to call in a prescription for you, because she's not your pulmonologist, cardiologist, whatever. And I don't find that that's right. If I'm in your face, you have the ability to write a prescription, write the prescription. And I feel like I've fired a lot of doctors for that purpose, because I don't have that patient-physician relationship. I'm human just like you. Yes, it's a job, but you, in this field, if you don't have the compassion for me, I don't need you to be a part of my care team. Absolutely not. And I had a physician in Florida. She was the best. She was, I'm telling you, phenomenal. Everyone in my family had her number. If something happened and I couldn't talk, they can call her. If I called her, she said, Serena, come on down, let's see what's going on. I didn't have to go and see Tom, Jane, or Joe. If she had the opening, she'll say, come and let's fix it. 2000, probably one, I started having some issues with my hands. And I went to her and I said, I don't know what's going on. I had these red things. And she said, oh my God, that's shingles. We got to take care of it right away. And just like that, she could have said, well, go and see your primary care, I'm telling you, would do anything for her. I said, because had she not attacked it right then and there, it probably would be all over me. And it's not something that's pretty. It's painful. It is extremely painful. But as she said, it's shingles. And since I had chicken pox, it started to develop in my hand. I said, thank God it was my hand and not my face or my back, or, because some people get it all over. And when you have an autoimmune disorder, you are susceptible to any and everything. So you got to be extremely careful. It's not like it's contagious. The suppression goes down. They usually say if you had chicken pox as a child, when you get older, you're open to get shingles. Like because age and your immune system goes down, you can get it. And that's why they tell a lot of people to get some type of vaccine, but I can't get it. I'm not, I won't get it. Even if I could get it, I won't get it. Because I know that it can cause me more damage than good. I feel like with this disease, there's so many things that can happen to you, and you think that it's nothing, but it's something. So if you feel like something is going on where you never had it before, you're wondering what it is, and if you have a doctor that don't listen, get rid of him. Get rid of him, because there are many doctors out here. You go from one to, I probably fired about 14 people before I found someone that I was comfortable with. A lot of them are blown away when they do see me in the hospital. Like, I've been in the hospital here twice, I want to say, for a while, for certain things. And they come into the room like I'm a study patient, because I've encountered so many different diagnoses. Lupus, myositis, transverse myelitis, Raynaud's, scleroderma, anemia, which I have had several blood transfusions recently, just had to have another one. The disease affects everything. So there's like no exception. So you cannot like cast out anything and say, well, no, I don't think so. You know what I'm saying? You have to take a look at everything. And every year I would suggest go and get a physical. If you're a female, make sure you get everything checked. After having chemotherapy on my third treatment, the third time I had to have it, I went into menopause. I was 36 years old. And I felt, it's a good thing, because at that time I was also dealing with anemia. But then again, it's not a good thing, because God created us to bleed until you're a certain age. You know what I'm saying? And people see it as a good thing, but no. Your body needs to be cleansed. and you wonder why we're dealing with a lot of sickness, it's a lot of poison building up in your body that should be eliminated on a monthly basis, and it's not happening, you know. And this has been now, LK is 23. Whew. I want to say 16, 17 years. It's been a long time. And it brings along with a lot of, different side effects. I mean, people look at it as a plus because of the anemia. I would probably be winding up having a lot of transfusions, which I don't feel like I should be doing. And like I shared with you, the health part of it, if I had the energy to do it, I'm sure I wouldn't need to go into nobody's hospital, because my mind, I'm very strong, and I believe in the science of God, natural nature. If He created it, it should heal us. But it takes time and energy to do it. It's not impossible. Thinking back, I could have been dead many times. But Rashika, my daughter, brought to me 2006 that I should change the way I eat. I fought it for a while. But when I made that change, I was already diagnosed with the disease. I saw a big difference. I didn't go 100% right away, and still, right. I cut out rice. I cut out white sugar, white bread, sodas, all that stuff like that. I cut it out completely. I used to have a lot of problems with my stomach, a lot. When I made that change, I felt the difference right away. I used to have a lot of problems with my stomach. Always hurting me, always feeling like somebody's stabbing me, or I'm bloated, or I'm gassy. Yeah, and I just cut all of that out. Then I cut out, I never really was a pork eater, but I used to eat beef. And I realized it took a lot for our bodies to break down that amount of meat. For a person who is not moving around as often as the average person, is even worse. So it makes you more toxic. So I stopped eating beef. I cut out chicken. I was still eating fish. I still eat fish occasionally, but I'm very funny. I barely eat rice. I'm not a bread eater that much. I try to stay away from that kind of stuff. I'll eat a lot of mushrooms and, fruits. I love fruits. I could eat it all day. But the only thing about it, it'll make you go to the bathroom a lot. But those things I felt helped me to transition. And it's mind over matter. Oh, girl, I can't eat no greens or whatever, because that was me. You couldn't, she's about, Ma, you need to stop. Don't eat that chicken. Girl, I said I've been eating like this all my life, and I ain't dead yet. I'm not going to die. But she was right. The changes that has been made in producing the products that's being made today, there's a lot of chemicals. Like even with the fruits, a lot of pesticides, spraying all this stuff on this stuff. You have to be careful. You eating chicken that they're injecting with hormones, So you have to be very, very selective and careful. I know, because that was me, raising my kids, and I'll say, I can't afford that. That's too much money. I got to buy this. But you can make it happen. You can make it happen. If you have to, prep your stuff. If you're sick, I had to learn these things. Everybody's not me. My family always tell me that I'm strong and I'm this and I'm that. And I know everybody's not me. But if you take baby steps, it's not impossible. You can just say, I'm not going to eat white bread this month. And next month I'm going to stop with the white sugar. You can still eat your sugar. Get some cane sugar, or get you some agave, or get you some honey, whatever you, but you don't have to drink the white. I can tell you that when I stopped with all that stuff, it helped me a lot. Pain, yeah, I still have pain, but not like I had the pain. It causes inflammation in your joints. White anything. It is not helping you at all. And I learned all these things, and I've been online and I've seen, or read some people with lupus asking questions. Do you get this? Do you get that? How you do this? And a lot of it comes from the food that you eat. Your diet is very important. And if you can change your diet, you might change your whole life. And I've learned that, and I'm not telling nobody that it's easy. We all have our weakness, but they have things that don't have the amount of dextrose sugar in it. That's, natural. I won't say really natural, but it's healthier than what you're putting in your body every day. My thing is, if I can help anybody with this disease, change your diet. Watch what you're putting in your mouth, and even the medications that they give you. A lot of people, they say, well, a doctor gave me this prescription, it must be good. They don't read up on it, they just take it. And then you start having side effects. Don't know where it's from, and it's from the medication you take it. Read, knowledge is power. And I know we're better in numbers, but if you don't have somebody there, reach out. Send an email, or whatever, and be encouraged to keep on reaching out until you get an understanding. Because that's what I did. I reached out to you, to whomever I can, to learn more about the natural life, living healthier and doing what's best for me to live. They said 20 years. It's 23 plus years, and I'm still here, and I will still be here. It's very, very important that we first believe, mind over matter. No matter what they tell you. I remember the doctor came into my room and he told me, when I couldn't urine, he said, you will be catheterizing yourself for the rest of your life. And I know the word of God, and I say, I rebuke you. I don't know who you are, but the devil is a liar. Yes, I was angry. Oh, I was so angry. I was mad because they tend to come in and throw these labels on you, and they want you to say, okay, all right, and get depressed. I said, who are you? You got the wrong patient. That was my exact words. I say, the devil is a liar. I rebuke you in the name of Jesus. And he just looked at me and he walked out. And 2 days later, that Foley was out of me and I was urinating. And I'm still urinating today. And that was 2015. This is 2019. You have to know, first of all, believe in yourself, know the God that you serve, and do not take whatever they say so lightly and accept it. You got to put your trust in God. Yes, God gave them the knowledge and the wisdom to treat us, but he has the final word. He has the final word. And then, I put all of that knowledge and my trust in God, my faith is in him, and that's who I lean on. Yeah, I go to the doctors, but I also go to him in prayer, because he says, everything by prayer and supplication, make our requests known unto him. So that's what we do. Be anxious for nothing. So that's exactly what I do. I go there, I see what they have to say, I do my own investigation, and then I seek the Father. Because I can't trust everything that these doctors say. People dying every day from doctors' mistakes. Every single day. Okay? I'm not telling y'all don't go to the doctor. But don't ever second guess yourself. You know your body. You know how your body operates. If something is given to you, you take it and you feel different, get yourself a second opinion or go online and do the research on the medicine that you have to see if that medicine is the reason why you're feeling a certain way. They'll tell you anything. I was just going through a period of time where my H&H, my hemoglobin, my blood levels were low, and they kept dropping, and they kept dropping. And the first thing they did was send me to an oncologist, a cancer doctor. Why? Why? You're running tests. It has to be something else that y'all can do besides automatically assuming it's cancer. Now, they'd asked me because I was dealing with a lot of nosebleeds and just my nose was bleeding a lot. And I went in, I had my nostril cauterized, which the blood vessels, they say, were thin, and that's why I was bleeding. They did that, and then they watched me for a while, and nothing changed, and it just kept dropping and dropping. And okay, well, it's lupus. Why is everything lupus related? If I was a person that was not a lupus patient, what would you do? Why not treat me that way? So she agreed. My rheumatologist, she agreed. She ran some more tests, and she said, well, she don't see anything. Everything seems to be normal. So I went ahead and saw the oncologist. He wants to do a bone biopsy. That's what they do for cancer patients. If you have cancer and you do a bone biopsy, it's a risk for that cancer to spread even more. It's a risk. Anything they do open up your flesh to that disease makes it spread. So he decides, well, they don't want to give me iron treatments. If that was you or somebody else, they would give iron treatments. Why not me? So I'm like, well, tell me why. I don't think it's going to be beneficial. He said he don't think it will be wise for me to do it until they do the bone biopsy. So I'm like, and I started praying. I say, God, I'm not going back. I'm not going to go back. I'm just going to do my own thing. So I started doing my own thing. And they started calling me. This is very critical. My rheumatologist called. She was like, this is very critical. I'm very concerned. If you're not going to go back, you need to go get admitted and get a transfusion. So that's what I did. I did a transfusion. Got a transfusion and went back because now they want to check me every couple of weeks, and it's still dropping. I feel it because I'm sleeping all day. I'm getting easily tired. I had no appetite.
When did it drop to?
6. Normal is 12, 13, 14 up in that area. So yeah, it was a 6. Now, I wasn't too afraid because I've been as low as 7.8. And I said, well, I'm still walking. Now, I'm not on my back yet. I should be okay. So I was doing my smoothies, doing the greens, bought the blood builder tabs and all that stuff, and still taking it, and it still was dropping. And they still didn't know. So I eventually gave in and did the biopsy. The biopsy just showed like 2% deficiency, so it wasn't that. Now, they still don't want to give me the iron treatment.